Welcome to Alpha Nutrition, your source for comprehensive health information. In today's video, we'll be discussing Crohn's disease and ulcerative colitis, two chronic inflammatory bowel diseases collectively known as inflammatory bowel disease, IBD. These conditions affect millions of people worldwide and can significantly impact a person's quality of life. Understanding the symptoms, causes, diagnosis, and management of Crohn's and colitis is essential for those living with these conditions and their loved ones. So, let's dive into the important details you need to know about Crohn's and colitis. What are Crohn's disease and ulcerative colitis? Crohn's disease and ulcerative colitis are chronic conditions characterized by inflammation of the gastrointestinal (GI) tract. While they share some similarities, they also have distinct features that differentiate them. Crohn's disease. Crohn's disease can affect any part of the GI tract, from the mouth to the anus. However, it most commonly involves the small intestine and the beginning of the large intestine, colon. The inflammation in Crohn's disease often occurs in patches and can extend deep into the intestinal wall. Symptoms of Crohn's disease may include abdominal pain, diarrhea, weight loss, fatigue, and malnutrition. In severe cases, complications like intestinal strictures, fistulas, abnormal connections between organs, and abscesses can occur. Ulcerative colitis. Ulcerative colitis, on the other hand, primarily affects the colon, large intestine, and the rectum. Unlike Crohn's disease, the inflammation in ulcerative colitis is continuous and typically starts from the rectum and spreads to other parts of the colon. Common symptoms of ulcerative colitis include abdominal pain, bloody diarrhea, urgency to have a bowel movement, and the sensation of incomplete evacuation. In severe cases, it can lead to life-threatening complications like toxic megacolon, a condition where the colon becomes dilated and at risk of perforation. Causes and risk factors. The exact cause of Crohn's disease and ulcerative colitis is not fully understood. However, researchers believe that they result from a combination of genetic, environmental, and immunological factors. Genetic factors. There is evidence of a genetic predisposition to IBD, as these conditions tend to run in families. Certain genes have been associated with an increased risk of developing Crohn's disease and ulcerative colitis. Environmental triggers. Environmental factors may play a role in triggering IBD in susceptible individuals. These triggers could include infections, diet, smoking, and exposure to certain pollutants or chemicals. Immunological response. It is believed that an abnormal immune response plays a significant role in the development of Crohn's and colitis. In individuals with IBD, the immune system mistakenly attacks the healthy cells of the GI tract, leading to chronic inflammation. Diagnosis and evaluation. Diagnosing Crohn's disease and ulcerative colitis involves a thorough evaluation by a gastroenterologist or an IBD specialist. The diagnostic process typically includes the following: medical history and physical examination. The healthcare provider will review the patient's medical history, including symptoms, family history of IBD, and any relevant past medical conditions. A physical examination will also be conducted to assess the patient's overall health and look for signs of inflammation. Blood tests. Blood tests are conducted to check for signs of inflammation and to rule out other potential causes of gastrointestinal symptoms. Stool samples. Stool samples may be analyzed to rule out infections and to assess for signs of inflammation or blood in the stool. Imaging studies. Imaging tests such as endoscopy, colonoscopy, and imaging of the small intestine may be performed to visualize the GI tract, obtain biopsies, and assess the extent and severity of inflammation. Treatment and management. The treatment and management of Crohn's disease and ulcerative colitis aim to control inflammation, alleviate symptoms, and improve the patient's quality of life. The approach to treatment may vary based on the location and severity of the inflammation, the specific symptoms, and the patient's response to therapy. Medications. Various medications are used to manage Crohn's and colitis, including aminosalicylates. These anti-inflammatory drugs help reduce inflammation in the GI tract. Corticosteroids. They are used to quickly reduce inflammation during flare-ups but are not suitable for long-term use due to potential side effects. Immunomodulators. These medications suppress the immune system's abnormal response and help control inflammation. Biologics. Biologic therapies target specific proteins involved in the immune response, providing a more targeted approach to managing inflammation. Nutritional support. In some cases, nutritional therapy may be recommended, especially in children and adolescents with IBD. This may involve exclusive enteral nutrition, where the patient receives all nutrients from a liquid formula, or specific dietary modifications. Lifestyle changes. Lifestyle modifications can complement medical treatments and improve the overall well-being of individuals with IBD. These may include stress management, regular exercise, smoking cessation, as smoking can worsen symptoms, and a balanced diet. Surgery. In certain situations where medications and other treatments are ineffective or complications arise, surgery may be necessary. Surgical options for IBD can include removing the affected portion of the intestine or creating an ostomy, where a portion of the intestine is brought to the abdominal wall to create a stoma for waste elimination. Living with Crohn's and colitis. Living with Crohn's disease or ulcerative colitis can be challenging, but it's essential to remember that, with proper medical care and lifestyle management, many individuals with IBD can lead fulfilling lives. Regular follow-up. Regular follow-up visits with the healthcare provider are crucial for monitoring disease activity, adjusting treatment plans, and addressing any concerns or new symptoms. Support networks. Joining support groups or connecting with others living with IBD can provide valuable emotional support and practical tips for managing the condition. Managing stress. Stress can exacerbate IBD symptoms, so finding effective stress management techniques, such as meditation, yoga, or counseling, can be beneficial. Health monitoring. Staying proactive about overall health, including routine screenings and vaccinations, is important for individuals with IBD, as they may have increased risks for certain health conditions. Crohn's disease and ulcerative colitis are chronic inflammatory bowel diseases that affect millions of people worldwide. Understanding the symptoms, causes, diagnosis, and management of Crohn's and colitis is essential for those living with these conditions. Early diagnosis and appropriate medical care, including medications, lifestyle modifications, and, in some cases, surgery, can help manage inflammation, alleviate symptoms, and improve the quality of life for individuals with IBD. Thank you for joining us today on Alpha Nutrition. If you found this video informative, please consider liking and subscribing to our channel for more in-depth content on health and wellness. Remember to consult with a qualified healthcare professional for personalized advice and treatment options. If you suspect you may have Crohn's disease or ulcerative colitis, stay healthy, stay informed, and take charge of your well-being.